Join Drs. Savanah Craig and Ronnetta Sartor as we navigate life beyond graduation. Real conversations about forging our own paths in our early years in our careers. There's a reason it's called practicing dentistry. All right, everybody, welcome back to Beyond Graduation. I am Savanah Craig, with me as always.
I am Ronnetta Sartor.
So, like we said, this season's going to be a little bit more raw, real, just our everyday experiences and a little glimpse inside our ever-growing text thread of would have told me some of the encounters I would have on a daily basis in dental school. I never would have believed you. And so sometimes you just need a friend or a group of people to hash out some of the just unbelievable situations we find ourselves in dentistry and healthcare. And so here's a little glimpse of our text thread, a behind the scenes.
Yeah, and I feel like this is going to be very relatable because I don't think I've met anyone in dentistry that hasn't said, you wouldn't believe what I've experienced, just recently. So
yeah. And I think, so again, more behind the scenes, we sort of record episodes once a month. They'll come out in various times, but we are December 2024, and I don't know if this is true across the board. I would imagine it is, but end of insurance year times bring with it more heightened emotions and complications around the holidays. So I think it's a perfect time to be discussing what's been going on in our practices these days.
So we'll start with you because you've had a lot of encounters over the past few months that I don't know. What was number one on your list? What's the number one scenario that's kind of taking the cake?
Yeah, I have had some encounters with patients making threats and having to call the police to the practice, which and trying to figure out how to make police reports and things that I had no idea I would ever have to do.
You might be able to teach a class on it if this keeps happening.
I will not still be here. I will quit. I will change my name. None of you will ever see me again.
You're going to move to a different country, change your citizenship and everything?
Absolutely. I did not sign up for this to have this many police encounters. We joke and we laugh about it, but it is disheartening and stressful. And this has been sort of the ongoing conversation that Ronnetta and I have had with you. Try to do your best for people, and there is a standard and an ethics of the profession and my own personal ethics, which is what guides my practice. And so I'm not going to cause more harm for a patient just because they don't agree with my treatment plan. And one thing I am very grateful for is in my residency experience, gaining the confidence in myself to say no. And we talk a lot about letting your no's be no's. And you don't have to treat every patient. And sometimes saying no is the right answer for your mental health, your staff safety, your personal safety, and your license. You know what I mean? At the end of the day, I worked really hard to get this, and I'm not going to let any one person jeopardize that if I can, whether that be threats against my license with the board or actual threats against my life or the life of the safety of my staff. So that's been really heavy and hard, and it sucks to live in a world where that's even a thing that people think they can do.
Mm-hmm. I had probably, when you and I first met, you were in residency and I was going through it at that time, but I had a patient who I performed treatment on, took some teeth out, teeth that were infected. And, if you showed any dentist in the world the radiographs, they would tell you these teeth are non-restorable.
Absolutely.
Um, and so pretty much after the fact, the patient wrote bad reviews and tried to make complaints to, the dental association as well as the board. And down the line, what it boiled down to was she wanted me to pay for bone grafting and implants in areas um, that I didn't put the cavities there. All I did was try to help.
Mm-hmm.
Um, and when we met during that time, I was at a crossroads where I was like, I don't know if I want to like keep practicing dentistry because I can probably read my notes back and probably replay every scenario of every interaction I had with that patient. In every interaction, I don't know what I could have done differently, you know. Um, Only thing I think that I maybe could have done is over communicated even more the severity of what was going on and that healing process and what that would be like. Um, but I agree, it is very disheartening. Um, and so when Savanah was going through what she was going through these past few months, I was like, I get it. And I was like, and just hearing what you're going through, it evokes the same feelings that I felt when
Mm-hmm.
I was going through that situation where, stuff like this could drag out for a very long time.
Yeah,
And then it's like, to what end?
exactly. And I think the thing that drives me crazy is that you could sit there forever. And did I explain it? And you and I are both documentation freaks because, shout out Dr. Curtis, but, he was on us all the time about these things. And at the end of the day, though, people are going to hear what they want to hear. And that's, I think, one of the hardest parts of dentistry. We always, the teeth are the easy part, honestly. Trying to take 5 years of information that I know and explain the most important things to a patient in 5 minutes. That's not going to scare them away from all treatment, but also make sure that they understand is really hard. And there's no good way to check understanding. I have people repeat it back to me, I have them sign consent forms. I repeat it, my assistant repeats it. But at the end of the day, we're all just doing our best. And I wish that people understood that we're humans and that this like impacts our lives. And I don't know, is it worth I mean, I've seen people with threats against their license and board complaints, and is it worth ruining my career because you're upset? But then this most recent one of like, is it really worth a threat against my life for treatment that like you caused these cavities and I'm trying to give a solution for a problem that I didn't start. And that can be so draining with dentistry.
I think you bring up a very important and valid point, right? And I think in today's society, and just in general, someone always wants someone to blame.
Absolutely.
So how do we make it so that we can get our patients educated well enough to know, what's going on with their oral health, but also have them get some skin in the game to be accountable for, okay, I can do this in a dental chair to help you, but in order to progress into having overall complete health, these are the things that you would need to do. You know, how do we, as a profession, how do we get patients to understand it and be as accountable for their own oral health as they hold us accountable?
Absolutely. And I think the other piece that drives me crazy is I've started saying this, and good, bad, or ugly, I don't have a magic wand. I can deal with what is in front of me today. And some options, honestly, are not great. Are dentures awesome? No. But sometimes that's the only option available. You are welcome to go without teeth. You are welcome to keep these infected, broken down teeth. I don't recommend it. I didn't get you in this situation, and I have had recently a couple of patients, two stories to this. One being patients that need partials. And are partials awesome? No. Especially, dual with no teeth behind, Kennedy class 2 mod 2. I had to Google this the other day. It was a whole thing. But
Distal extensions.
distal extensions, thank you. They're gonna flop around. There's nothing holding them in there. And patients are like, this sucks. I'm like, I bet it does. But if you don't have room for implants, or you can't afford implants, and implants are not the end all be all for
They
everyone.
have complications too.
Absolutely. But there are only so many options here. There's only like 3 ways to replace teeth. And if you have no tooth behind, I cannot put a bridge. There's nothing to bridge to. Like, and it's just trying to explain, like, this sucks. I hear you. I am so sorry that you lost all of your back teeth. But that's the reality. We got no back teeth. If you want new teeth, we got one option because you don't have enough bone. And if you don't like it, go without them. No skin off my back. And then the other one is people with like just complex medical history. I've had a couple of patients recently on Reclast, Fosamax, all of, these bisphosphonates with terminal dentition. And, well, why didn't anybody tell me that I needed to go to the dentist if I was going to be on this medication? Why didn't anybody tell me these? I don't know. I don't know the conversation that was had with you and your medical provider. And I'm super sorry that we've ended up in this situation. However, the reality of it is you got to go to the oral surgeon.
Right. And then sometimes, unfortunately, oral surgeons are getting to the point where, depending on the medications, they may be sending them to the endodontist.
Yeah.
You know,
And then the callback, well, they don't accept my insurance. That is not my problem. I am so sorry. Like, you know what I mean? That doesn't
yeah.
mean you can't be treated there. And that doesn't mean that that's not the right answer. And I understand, like, finances, I hear you, absolutely. But I can't change it. You know what I mean?
Yeah, I get it. It's tough because the reality of there's so many like geographical um and financial obstacles
Totally.
that some patients face to receiving the proper dental care. But in the same breath, it's also okay. Well, how do I be everything for the patient, but also give back to myself so I'm not left with my cup empty and trying to possibly redecide if dentistry is what I want to do. And I think this is what makes having your why really handy, because on those days where you're just like, why did I do this to myself? Right?
Absolutely. Absolutely.
Why did I go through all of this schooling to be in a profession where people hate me?
Say it again.
Right. Yeah, for the people in the back, right? Yeah.
Yeah.
Why did I do this?
I gave up my youth.
Everything. I gave everything.
Yes.
I have nothing left. Nothing left. But my why.
Yeah.
And that's why having that, having a strong community around you to build you up when you are just um so down and don't know what to do. um I think that's extremely important. And then having ways to come back to yourself, because we also live in a world where Google reviews is a whole thing. You know and so just knowing who you are as a person, what your intentions are, that you have good intentions. You're not trying to hurt anybody. You're not trying to make anyone feel away. All you're trying to do is be there and provide relief, help transform smiles. And you're doing the best that you can, just like our patients in most cases are doing the best that they can.
Yeah.
So, what would you say from the tough couple of months that you've had, or few months that you've had, what is your biggest takeaway? What would you say you'd love to share with our listeners to help them through those times? Or what would you like to share that maybe in retrospect you feel like could have been better to help de-escalate some of these situations?
Over communicating is absolutely number one, and that does get exhausting. But also remembering that you're human and that you are doing your best. And I've had this conversation a lot with my grandparents who are getting older and have multiple medical things and whatever, and um, reminding them like their doctors are also human and we are all working with the best bit of knowledge that we have, and sometimes that's not enough, but human bodies are super weird and we don't always have the answers. But for me, the thing that's got me through is community and being able to text Ronnetta and be like, this is the craziest thing that's ever happened. And I told my assistant, I hope I never again hear you say, Dr. Craig, the police are here.
It might be famous last words before you go to
Yeah.
another country, right?
Goodbye forever. I will change my name. I was like, I would be a really great bartender on an island somewhere. Like I'll make the tips, I'll make the frou frou drinks. It'll be great. And Adam just shakes his head. But yeah, having your community to laugh and cry and scream with when these things happen is unbelievably important. And I've been so fortunate in the practice that I'm in to have support from the whole team and also my boss and the partners in the offices to check in on me and know how to file a police report and how to make sure that I'm protected as well in these situations has been I would not be as okay with what went on without knowing that I was supported and protected to the best of the ability of those around me. So having your people and leaning on your people and knowing that you're really not alone in this and everyone has had a insane encounter or seven. And the other thing is trying to, how many patients have I seen in the last 6 months? A million, probably. No, a lot.
I say,
And
wow, you're really
we're
you're really
rolling.
working over there in
No.
Ohio.
Yeah. But you know what I mean? What is
Yeah.
the ratio of fine, normal, reasonable patient interactions versus these couple of really difficult ones? It's really a small percentage. Not that they don't live in the back of my head probably for the rest of my life. But what about you? You've been doing this longer than me, and I'm sure have so many more stories that you could tell of varying degrees of frustration.
Yeah. I think more than anything, like you said, is just over communicate from the beginning of the appointment to the end of the appointment. If there I'm at the point where if there's anything that I feel went awry during an appointment, or if it was a difficult procedure,
Yeah,
I'm making a call or having my team make a call for me the next morning, following up with them.
that's good advice.
Even if a patient calls or emails and has a complaint, I'm getting on the phone and I'm talking to them.
Yeah,
Because I think at the end of the day, people just want to be heard. And when they
truly.
feel like they're heard, now I do think, like you said, there's a very, very, very small percentage of people that you just cannot reason with. But I
Yeah,
think it for that very small percentage, like you said, having those securities in place and being able to disengage and not continue a doctor patient relationship
yeah,
is key. Um, but I think the majority of the people mean well,
yes,
and a lot of times it's a communication issue. And the more we can communicate, but also the more that we can hold ourselves, but also letting the patient know what their job is as it pertains to their oral health is key.
The other part that I'm learning more and more is trust your gut. And I haven't figured out exactly how to communicate always to the patient that this isn't, I don't think I'm the dentist for you, but doing your best to just get them out of there if you've got the feeling that this is going to go sideways.
And I think with time, the verbiage for that becomes easier.
Yeah.
If I see that maybe we're clashing or we're just not on the same page, there's a nice way to say, I know someone that I think you might be a better fit for in terms of what you're looking for. And it's okay to say that, maybe where I am in my journey in dentistry, I don't think that lines up with what you need, your oral care needs. And then, wishing them well and helping them move on to someone that could better care for them. But that's part of communicating, right? Like them letting you know and you letting them know, okay, I don't think that this is working.
Yeah. Yeah.
And I would be doing you a disservice to continue this relationship, patient doctor relationship, if we're not moving forward.
Yeah.
This is a super interesting topic. We could probably talk all day, but at some point we have to end. So friends, let us know. I'm sure you guys have had some crazy dental experiences. It can be with team members or, anything in your office, but we'd love to hear more, and we'd love to hear how you keep going. Thank you for joining us for this episode of Beyond Graduation. If you enjoyed this week's episode, be sure to share it with a friend. Connect with us on social media at Savanah Craig DDS and at Dr._Sartor. And remember, you are not alone on this journey.
Thank you for listening to Beyond Graduation, brought to you by Ignite DDS and Future Dentists. This episode was sponsored by Ignite DDS Coaching. We build self-determined futures. For more information, please reach out to the Ignite DDS team.